Hey guys, welcome back. I'm the info dentist, and when it comes to oral appliance therapy for the treatment of obstructive sleep apnea, especially in patients who are intolerant to CPAP, I normally go to one of 26 different models, different types of oral appliances. And today I'm going to show you one of the newest oral appliances on the market. It's already one of my favorites, and I'm going to tell you why. I think you're going to like it as well. Let's get started. So, if you suffer from obstructive sleep apnea and you've been prescribed a CPAP, normally just over 50% of patients that are prescribed a CPAP can actually tolerate one. So, what the American Academy of Sleep Medicine recommends is that if you are not tolerant to CPAP and you have severe obstructive sleep apnea, you resort to an oral appliance. I'll tell you what that is now. If you have mild to moderate obstructive sleep apnea, then what the American Academy of Sleep Medicine recommends is that you are given a choice whether to treat your sleep apnea with an oral appliance or a CPAP. Now, what is an oral appliance? Well, an oral appliance is a device that's placed on your teeth right before you go to bed. And what it does is it keeps your jaw in a particular position where when you lose muscle tone, once you doze off, all the soft tissues don't drop back into the back of your throat and obstruct your airway. So here we have, for example, a couple of appliances that we use. We use one of 26 different sorts of appliances. And the latest one of my favorites, is this one. It's the Avant by Somnomed. And let's take a closer look at this device and why I absolutely love that oral appliance. So this is how we receive the device back from the lab. And what we normally do is we scan the patient's teeth, and I'll show you that in just a bit. In this particular case, we took regular impressions, as you can see here on the sides. And it's a very small device. I love this device. It's very comfortable. It fits snugly on the teeth. Normally we don't have to make any adjustments to it. It's very easy to get accustomed to it. And what we do is we change out these straps that you can see, these blue straps, until we position the jaw comfortably in such a position where when you lose muscle tone and your muscles relax when you doze off, you don't obstruct your airway. It's quite small, only the front touches, as you can see here, which allows for less pressure on your joint if you are a bruxer, if you do grind. And we can have easy movement from left to right, lateral movements if you are a bruxer. There's a lot of space for the tongue, as you can see here, and it allows for great movement from side to side. I love this device. Small, sleek, it's not fixed in place. In other words, it's not rigid. And here we are scanning the patient's mouth. And this particular scanner, not only do we make crowns and bridges here in the office with this device, but we can send this off to the lab, and then the lab can fabricate with great detail the oral device. Here we have the device in place. As you can see, it's easy to move the jaw from side to side. Minimal coverage of the teeth with excellent retention. This device is not going to fall while you're sleeping, and it will stay in place. Easy to use, easy to get accustomed to, great for patients with huge, large tongues. Not everybody qualifies for this. You would have to come in, like I said, we do use one of 26 different types of oral devices, and it depends on various variables. So not everybody will qualify. for this particular one. But if you do, it's a great device. Again, with the purpose of alleviating and bringing your obstructive sleep apnea under control if you are CPAP intolerant. That's what we do. Hey, if you like this video, I'd love for you to share it on your social media so that we can help get the message out to those people who may be suffering unnecessarily from obstructive sleep apnea. You never know, you may even save their lives. Also, if you like this video and you want some insight into your particular sleep apnea situation, I've set aside some time on my calendar for people who watch my videos. Just go to the link below and schedule your brief video consultation, and I'll go over with you your particular options based on your particular situation. Here's to you and your loved ones sleeping like a baby again, and to your health. Make it a great day.